So, all right, welcome, friends, to Facebook. And it is a privilege to welcome a friend who many of you will know, Sheila Baker, who grew up in this area and has worked in different places and is now back in the Muncie area working. And we are just grateful that she's joined us tonight. One of the reasons I wanted to invite Sheila to share is not only to get to know her better, her and Brian and their history, but also she is a medical professional. She's a doctor. She works on campus here at Ball State. She's been studying not just what we're dealing with currently, but uh, medicine for a number of years. So Sheila, welcome. Tell us a little bit about your background, your history.
Sure. Well, I grew up in the Liberty Perry Township area, went to Perry Elementary, Selma Middle School, graduated from Wapahani. Then I went on to Olivet and graduated from Olivet with my degree in zoology. And then went to Indiana University, School of Medicine, graduated from there, did my residency program at Ball Hospital in family medicine. So here locally. And then really after that, moved to Illinois and practiced for 20 some years in Illinois. Started out in private practice, did that for about 8 years, and then did the rest of my career at Eastern Illinois University, so a public university in Illinois. It's about an hour west of Terre Haute. I retired towards the end of 2017, but actually then moved back to Muncie with Brian and got a job at Ball State, and I've been working in the health center there since December 1, 2017.
Wow. And that it's exciting because you are really, as we think about medical issues, you're right there on the front line, both of what you've done in Illinois, now back here at Ball State. You also did a little bit of medical work, some medical missions work. Would you want to share a little bit about that?
Well, I did 2 months actually of my 4th year of medical school in Swaziland at the mission there. It was at that point run by the Church of the Nazarene. So in Manzini, Swaziland, did a couple months of medical school. And then I've done a couple airlifts with Heart to Heart and Physicians with Heart, a humanitarian group that brings medical supplies to areas over the world that need that. I've done that. And then I've done some mission trips like to Panama and things like that, where if I could help out medically, I would do that as well.
You know, that's exciting. I think sometimes we take for granted the medical help that we have here in our country. I mean, we can easily go to see a doctor and any kind of a specialist, whether it be a health professional or something dental related. I went to see a skin doctor yesterday. I mean, there's all different kinds of specialists, and probably some of those areas you were at, you were kind of like everything, weren't you? And trying to bring medical help. Anything in particular that just sticks out in your mind from your work in Swaziland or some of these other medical missions?
Well, just a kind of a funny analogy. In Swaziland and in many developing countries, paper products are at a premium, and they're really not available. When a patient would come into the hospital, the family would be the ones who would bring the cloths or the rags to clean or to care for the patient, because there was no toilet paper, there were no tissues, there weren't those kinds of products. And so now here we are back in
Sure.
2020 in the United States, and worried for products
Sure.
and masks and things. So
Yeah.
but just kind of that funny analogy, you make do, but yeah.
Yeah. And that's kind of scary because I think you could tell us that even in the world today, there are many areas that have that same struggle. We're very blessed. We're very blessed here. Tell us what kind of medical work are you doing at the campus at Ball State?
Well, I see the students. Um, that's what I do mostly, and I'm in the general medicine area. The clinic obviously has a women's health clinic, a general clinic, and then we also see employees for on-the-job injuries. And then there is a clinic downstairs for employees and their families for kind of an urgent care setting. But I basically take care of college students.
And that's a big deal. I mean, do you have, I can't remember, how many students would you estimate we have at Ball State? It's a pretty big place.
21,000, I think, is
Wow.
21, close to that. Now, not all those are always on campus all at the same
Sure.
time, but
Yeah.
pretty large organization, large for good old Muncie.
Yeah, for East, it really has been the lifeblood of East Central Indiana, at least the last 20, 25 years, since a lot of companies have relocated outside this area. So, well, thank you
Yes.
so much for your work there, because a lot of times those kids that are there, I mean, they're away from home. And as we all know, college kids can get crazy at times and do stupid things, or maybe they have other issues. Maybe they have mental health issues. They need a counselor. They need some guidance. So I know your plate is full there. One of the reasons I wanted to ask you to come on and share with us tonight is we're among all kinds of groups, all kinds of churches, endeavoring to create a model to come back to church. Obviously, we're eager to come back, but at the same time, and I know I visited with you the other day about this, we want to be very, very cautious, and we don't want to get lost in our eagerness to come back and worship and lose the, I guess, the safety that we need to have to re-enter. So next Wednesday night, our board's going to meet. We're going to have a Zoom call and talk about some thoughts. And I've talked to different pastors, and everybody has their own plan. But I think one of the things that's neat about you, Sheila, about coming on is you know our church. You know us inside and out. And you know that we're a diverse group. We have some young folks, and then we have a large constituency of folks that would fall in that category of 65 and over. So what, maybe in some of your reading and study, what are some things that you see that would be important for not just our church, but probably other churches to undertake?
Well, I used some notes that we're every day receiving information from all organizations that are related to healthcare, whether it's the AMA, the CDC, or the American Academy of Family Physicians. But they are starting to send out more and more documents about reopening. And obviously there's the private sector and there's the business sector, but in healthcare, reopening our clinics also should be done in a phase in so that we can assess and see, okay, is this still working? Is it working in the community? Is it working in our healthcare facilities, so that we can monitor and then adjust, continue to proceed and open things up more, or do we need to step back, or have we entered a different phase? So a lot of the notes I took for how we would open up our clinic, which I'm really not in administration any longer. I was for many years at Eastern, but now I'm in my role, I just really see patients, but still started to take notes on what does it look like to reopen a medical clinic. And I kind of then took those notes from documents I've been reading and kind of said, how would that look in a church setting? Obviously there are differences, but how could we just kind of overarching build that into a reopening the church type setting?
Sure. What would be, just kind of walk us through, maybe not the whole process, but kind of just the early stages, maybe some, I don't know if I'd say warning signs or just things to be, what would you say would be like the top 2 or 3 things to be aware of at the beginning?
Well, I think be safer than, or be a little more strict than more lenient. We don't want to be the people that hit what we call hit the radar. I always feel like if we can stay off the radar because we're doing everything we can to be safe, stay safe, then we're not going to get the criticism, if something would go wrong. So in my opinion, start slow, make crowds very small at times, make certain that if somebody was, if the paparazzi arrives trying to find some excitement or news, they're going to be disappointed, because everyone is going to be very respectful of other people, wearing a mask, wearing it correctly. We are using hand sanitizer as we enter a building so that our hands are clean. We're protecting our noses and mouths so that we aren't spreading potential germs to other people. We're keeping our distance.
Mhm.
Just things that are just very thoughtful to continue that respect so that we don't unintentionally spread an infection.
Mhm. Good, good.
I'm staying clean, I'm staying away from other people, then less likely that our church is going to become an area where the virus continues to spread.
Right. I like that word, respectful. I really do. How would you help people? I'm thinking of people that are really eager to get back soon. I know that we have people, I've talked to different ones like, hey, we understand we got to keep the brakes on. We just got to, slowly. So how would you help maybe encourage or speak into that person? It's like, why can't we just get back now? Is there anything you could direct to that person in a kind, loving way, just to let them know we're okay, but we don't want to rush in?
Well, and it's hard for me not to get medical as I would explain that, because we can't see this virus. It's invisible. And I think that's what makes it so hard. If we could see it, then we'd all know and we'd say, oh, I'll stay away because I can see that danger. And we can't see it. And we sometimes have the virus when we don't know it. So those are things that in the healthcare profession right now, and in my world, those are the scary things. We can't see it. We don't even know when it's being spread because people who aren't sick are spreading the virus. And
Yeah.
yet we are seeing certain groups that are at such high risk. No one wants to be the one to give another person a virus, let alone a person very susceptible who it could potentially cause very, very serious disease or even cause death. So,
Yeah.
it's something we can't see. We don't know we're spreading it. We don't know where it could be. And that's what makes us very hesitant to
Right.
just open doors wide open.
Right. I guess I kind of have a two-part question here. Same question, but just two sides. One side is, what information would you recommend for us to stay tuned into so that we're not taken off the path? And what information would you want us to stay away from? I mean, because in all these situations, and I know you're studying every day, there are things you lean into for information and things you just say avoid. Any thoughts on either one of those?
Well, I do think that as governors are putting together their phase-in plans, they seem to be fairly well thought out. That it make sense as far as I'm not talking about a specific business per se. I'm just saying we're going to open things slowly and we're going to let gatherings be a little bit bigger, and then we're going to look and we're going to watch, and if that's okay, we'll go the next step. So I feel like the governor's recommendations in this phase in would be fine to kind of to watch that. I also, I think the federal government is also looking at some of those things. Um, even people that seem to be well-meaning and well-knowing, I've seen some things on videos and I'm thinking, that just doesn't sound quite right. And then we find out a few days later, that was not founded. So, I never tell people to go to sites. The CDC is a place I've always trusted. When we
Okay.
had the swine flu, H1N1, back several years ago, again, we didn't have a vaccine for that initially. A very different virus, something that we could, we had treatments for where we don't with this specifically. But I just said, you know what, we're going to follow the exact guidelines of the CDC for colleges and universities. I'm not going to veer off that path. I'm not going to go rogue. If the CDC or the NAIAD or those organizations that are monitoring and are the infectious disease specialists of our country, if they're saying it, they've got the most knowledge. We've got to follow them. It may not be perfect, but I would trust those sites.
I like both of those thoughts. The CDC. In fact, I had another medical professional that told me, they said, just get that app on your phone because it'll
Right.
help you track this as well as other things that may be happening around the world. And it gives you just little snippets, and you're not just taking off on all these rabbit trails. Another thing you said I think is very important is listening to our governor. I've been very thankful for the different experts that he's brought in, the way he's handled his news conferences. It sounds like he's really doing his homework for the good of everyone else. So good, good. I know that you gave us some steps here, and we're going to be looking at those further. What maybe I guess one thing I think of too is do you have a like a warning sign or something that just I don't know because again as a medical professional you're aware of all these things. Is there anything in particular we just need to say, just be careful of? I mean, anything that just jumps out?
Well, I think wearing a mask in public all the time or a face covering right now, if you can do it, you should. Everyone should. It just makes sense. If I'm not sneezing, coughing, talking, and spraying my my respiratory droplets on another person, I'm being again respectful, but then also other people then are hopefully not spreading it to me. Washing your hands frequently, anytime
Sure.
you're going in and out of businesses, touching your face, those kinds of things. Continue to wash your hands. And if people can't do that in businesses and in places such as church, then, if you just don't feel that that's for you, then maybe it's not time for you to return, at least to church, because again, you could be putting others at risk or yourself at risk, and we just don't want to do that.
Yeah, that's good. Well, hey, I really appreciate you coming on. And over the next few days, we're going to be emailing out things to our church folks, and we'll include some of these specifics you gave us. But I really like what you said, Sheila, about being respectful, about protecting yourself because you're protecting others. I think that's one thing I had to learn early on. I'm a healthy person. I rarely, if ever, sick. Rarely, if ever, need to use Kleenex for a cold or flu or whatever, or sniffle. But I can be from what I'm learning, and correct me if I'm wrong, I can actually be a carrier and not even know it. Is that kind of what we're dealing with here?
And some of the most recent information is saying we're probably most contagious when we aren't even sick, when we don't even know we have the virus. So again, when you say, "Hey, I'm healthy," that's when you're probably the most contagious to other people.
Yeah. Okay. Well, I appreciate your work and appreciate, I just consider it a ministry, what you do on the campus of Ball State, because I know that I've served with trustees at Olivet, and I know that the people who are the medical professionals on campus really handle things that the professors may not even know about. Students that are struggling with physical issues, psychological issues. I mean, you're right there on the front line. So, hey, if it's okay, I'd like to pray for you, and then I'll let you close if you have any other thoughts. Dear Lord, thank you for Sheila and for others on the campus there at Ball State. Over 20,000 students. That blows my mind. Thank you for what they're doing there to bring health and to bring hope to those kids. And some of those kids are really struggling away from home. And we know these are different times, and most of the students are not even on campus now. But Lord, when they do return later this summer and especially this fall, may you just continue to give Sheila and her staff the wisdom they need to minister in a health way and also in a spiritual way, Lord. Even though Ball State is a secular campus, we know that Sheila has a heart for you, Lord. So just use her and the others as they minister on that campus. And Father, thank you for the information we're hearing. Help us to use wisdom, Lord, and as we think about responsibility and respecting others, Lord, may that be our guide in these days. Thank you for this avenue, this venue known as social media, where we can come on here and freely share and even freely pray, Lord. So use this as some help for people that may have some fear tonight, may have some question marks, and may just need a little assurance. Thank you for these moments. In your name we pray. Well, hey, thanks for coming on, and we'll be in touch, and we'll just keep the dialogue going. And earlier we were talking. You were actually at Menards. Now, before we jump off here, you said Menards was using a little bit of some screening people. Is that right? When they come in, is that what you were finding?
Someone at the door. There's only one entrance and one exit. They do have someone wearing a face mask. Most of the employees that I saw had on face masks. Of course, they have the X's, I think, on the floors, or asking people to stay 6 feet apart. I
Sure.
see arrows and things like that. But as you come in, and then they're sanitizing the or trying to wipe down the carts. So they ask you to take a cart that's been wiped down. But people seem to be again very respectful, keeping their distances as they're being asked.
That's cool. Well, hey, thank you so much again, and blessings on you. And thanks for, I appreciate you and Brian so much, and your ministry in the community and your connection with Harris Chapel. It's great to have you back home. In fact, earlier, we'll close after this. As we started the interview, your mom was calling in, so I'll go ahead and call her back now. So
Hey, you do that, and be very moderate in your donut consumption.
yeah, I've got to be careful. Although when I did go in today, seriously, when I went in, they had a huge plexiglass wall all above the donut area. They all had on blue rubber gloves, and get this, over the rubber gloves, they were wearing plastic, clear plastic serving gloves. And after they loaded up each load of donuts, they went to the checkout. They checked the person out. They took off the outer plastic, put on new. So they were doing a good job at Concannon. So, hey, thanks so much. Tell Brian we said hi.
Have a good evening.
You too. Thanks, Sheila. Bye-bye.